I heard him coming up the stairs to my, I didn't know that it was him because you always think it's going to be something else, but
10 years ago, Maya was assaulted repeatedly by a man who worked for the State Department of Social Services, who threatened to take her child away from her if she didn't have a relationship with him. And she was terrified, intimidated, and she went along with him.
First of all, he went over, it was into my living room, and he went over, and there was a huge yucca plant that I had that was about 6 or 7 feet tall, and he just sort of started breaking it into pieces and breaking it.
And in the course of that relationship, there were at least a half a dozen episodes of torture and of rape, and she endured all this. Maya suffered from the most dramatic symptom of PTSD, painful, intrusive memories.
I always thought that whatever he was doing, that the next thing that he did, that was going to be enough. And
this video explains and demonstrates the counting method for recovering and mastering traumatic recollections. She and I didn't get into the details of the 6 or 7 episodes in which a particular individual terrorized, traumatized, and raped her until we were in the 6th or 7th month of therapy. In the beginning, it was important for me to understand more about her in general. Oh, I had an idea of what occurred, but we didn't go for the details. She required some medication because in addition to everything else, she had panic attacks. And she was somewhat obsessed and depressed, and she responded very well to the medication Prozac, which I believe is often a useful adjunct when repetitive chronic distress has occurred and there are signs of depression and obsession as well. So as her sense of security improved, as her ability to laugh returned, as her competence as a school teacher was restored, then she was ready to remember. So we're going to be demonstrating a technique from post-traumatic therapy work that Maya and I have used in the past, and we're going to do it again, and I'm glad that you're agreeing to go through this. Maya and I developed the counting method in which I count out loud to 100, and she remembers without speaking while I count out loud. This gives her a chance to have the privacy of her recollection, the intensity of her recollection, without needing to translate it into words for me. This method should be considered when therapist and client agree that significant progress has occurred, but intrusive recollections remain. Let me ask you to choose from among one of the episodes that we've talked about in the past, a single one, and as we did before, I'll count, and you'll bring this time of your life into mind and allow yourself to feel the feelings from that time as intensely as you can tolerate. I'll be counting to 100. You can let the intensity crest as I get up to 40, 50, and 60, and then let that subside, and when I'm in the 90s, remind yourself that you're here.
Yeah, I was like 90. That's my favorite number.
The first step is a discussion of the method and its rationale, leading to ideal timing. Timing refers to both the phase of therapy and to the time within the session. This way, the stage is set.